Hi, I'm Dr. Stephen Stokes from APS here in Fort Myers, Florida. So if you're having post-surgical pain, obviously the very first thing you want to do is talk to the surgeon, make sure that the surgery was successful. Make sure you get cleared by him. Most surgeries are successful. There's a lot of good surgeons in Southwest Florida, especially in this area. And normally surgeries are pretty straightforward. You know, if they're operating on an ankle or a back or the neck or the shoulder or something, those surgeons go in with a very specific idea of what they want to do, reattach a tendon or remove a bone spur or something. And normally, it's very difficult to mess that up. Post-surgical pain is very common. And the first step in getting better is to realize that usually the surgery is not the problem. The surgery itself can promote pain syndromes. You know, surgery is an invasive procedure, and just going in there and cutting tissues and separating different layers of fascia can really irritate the sensory nerves and cause pain. Over time, as the body heals that area and builds scar tissue, that scar tissue can also irritate the sensory nerves and sometimes even irritate what we call motor nerves, meaning that after a surgery, you'll have trouble moving muscles and things. So very important to get the proper type of therapy after a surgery to make sure that everything heals properly. We like to use class 4 laser for that, which has a lot of really good research on helping the body to heal, helping regeneration of damaged tissue. We use a procedure called Hakumed, which uses electricity to help with that. And one of the treatments that we do that a lot of people don't know about is called Gua Sha. And Gua Sha is a procedure based on an old traditional Chinese medicine procedure where we will stimulate the area of the surgery. It doesn't hurt, but we'll stimulate it to cause vascularization of that area. So what we're interested in taking existing blood vessels that are around the surgery and stimulating them so that those existing vessels will grow new branches, right, into the damaged tissue. New blood vessel branches means more blood and oxygen more blood, oxygen, and nutrition getting to those damaged tissues so that they can repair quicker. And there's been lots of good studies on the procedure, and it shows that if done properly, it can really assist in healing and recovery post-surgery. The key is you want the tissues to heal correctly, and you want to also get your mind right so that you're not constantly thinking that you've been injured by the surgery. Again, most surgeries are successful. The problem is post-surgically, the collateral damage of the surgery really needs to be treated. And so that's one of the things that we really focus on here at APS. We see a lot of people, for example, who've had ankle surgery or shoulder surgery. Like I mentioned before, if you've had a shoulder condition where you have a complete tear of the supraspinatus muscle in your shoulder, I can't fix that. Nobody can fix that. So you have to have surgery. So then a patient will go and have surgery on that, and then immediately after surgery, the doctor will order physical therapy to strengthen it and stuff. And that's ridiculous. Like, that is the worst thing you can do, because what you want to do is after the surgery is you want to provide the body with what it needs so that you can heal properly. Heal first, right? And if you ever cut your finger, you know how long it takes the finger to heal. And you know that if while you're trying to heal a cut, for example, on your hand, if you're constantly irritating it or picking at it, it doesn't heal right. And so we really want to take the time after surgery, first get cleared by the doctor, make sure that the surgery was successful. Make sure you don't have a sponge or something still in your body. And then if he clears you, then you want to really pursue an alternative to physical therapy where you're just going to go and exercise. And you want to pursue treatment that's going to assist the body in healing the collateral damage from the surgery. And that is one of the things that we provide here at APS. So I hope that was helpful, and I hope that will give confidence to people who've had surgery and are still in pain. Make an appointment, come and see me, let's have a look at it. And a lot of times we can produce very good results within 2 weeks of starting the procedure. The things we do here are not common, they're different. So we use things like laser and Gua Sha, like I said, but we get good results. So thank you very much. If you have any questions, go ahead and email me or stop by the clinic. Thanks.